You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET Podcast.
Hey guys, Doc Teams here. I want to talk a little bit more about dysautonomia. What the heck is it? You might be hearing this more and more because it seems to be happening more and more. You know, dysautonomia is basically a constellation of symptoms that describe what's going on, right? Oftentimes people have headaches, they have chronic fatigue, they have dizziness, and they have brain fog. These things are probably the most common symptoms that people describe. The other things that they don't describe, but they tend to have going on at the same time, are things like digestive issues, insomnia issues, other chronic pain issues, right? When you have this list of things going on, you tend to have triggers, things that activate those symptoms, right? So like for people that have POTS, postural or positional orthostatic tachycardia syndrome, basically when you stand up, your heart rate gets out of control high, right? And so POTS is a diagnosable level, right? Way over on this end of dysautonomia. So you've got normal over on one side and POTS on the other side. Everything in between is basically dysautonomia, right? And so triggers that might kick up anxiety goes up, and that basically is driving our fight or flight system. Well, our fight or flight system goes up, and that starts to create constriction in every single blood vessel in our system, right? Our brain thinks that we're running from a bear. And when we're running from a bear, right, if I'm literally running through the woods, what's happening at the level of my arms and legs, we're getting dilation of those blood vessels, so more blood flow goes to those areas under demand, right? So has anybody out there ever wondered why, if you get anxiety, your fingers and toes or your arms and legs and face can even tingle? Well, it's because your brain thinks you're running from a bear, and your arms and legs should be active, but they're not. So when our fight or flight system cranks in, everything constricts. When it constricts, it decreases the amount of perfusion or blood that gets to the tissues. Happens both at the level of our brain and our body. Okay? When that fight or flight system cranks up, we constrict, rob blood flow from the vital areas in our brain and our body, and then we start to get symptoms, right? If it happens in our brain, we tend to get brain fog and dizziness. If it happens in our body, we tend to get like weakness in our arms and legs, and also tingling in our arms and legs. We might even get pain, right? I've had tons of people with this issue. On top of that, when you lack blood flow in the brain, and your system is just cranking higher and higher on that fight or flight, almost without a doubt, we're going to deal with headaches and migraines. So dysautonomia is no joke, right? If you have anxiety, brain fog, chronic fatigue, headaches, migraines, dizziness, or even insomnia issues, like give us a call. We can seriously help you guys. But it all has to be done after we do our physical, neurological, and like chemical evaluations on your system, okay? Anyway, wanted to take a minute to explain some of that to you, and otherwise, you guys have an awesome day, and hit me up if you have any questions, okay? Catch you later.